Good afternoon, everyone. I'm joined by Public Health Officer Dr. Bonnie Henry, and we are, of course, on the traditional territory of the Songhees and Esquimalt First Nations. We want to announce today some changes in how British Columbia is approaching the next phase of our four-phase plan to restart the economy. While the dangers and risks of COVID-19 have not passed, British Columbians are more confident and we're acting in a way that will allow us to take that next step. We've been careful in this restart plan, focusing on protecting people while we make progress going forward. We've seen our friends and neighbours going out to restaurants, they're enjoying parks, and many kids have gone back to school to have fun with their friends in classrooms and to learn and see their teachers for the last time in this school year. I take an example of the changes we've seen over the past number of weeks. TransLink weekly ridership last week was more than double what it was at the COVID low point of April 5th. And ridership on BC ferries is increasing as well. We're interacting with more people, and by following the advice of public health officers and officials, we've been able to keep our transmission rates flat. And that's thanks to the hard work of British Columbians, and I believe that the announcement of the next step of our provincial restart plan is appropriate. Under the guidance of the public health officer, we are now able to move slowly into phase 3 of our four-phase plan. This means more businesses listed under phase 3 of our restart plan will have the guidance of public health and WorkSafe to open safely. It's the work of the Public Health Office and WorkSafe BC that has allowed us to develop the guidelines we'll all need to have a safe reopening of things like hotels, resorts, parks, the film industry, and some entertainment venues like movie theaters. Many businesses in these sectors have already started opening with COVID-19 safety plans in place. Phase 3 will also allow more opportunities for us to travel safely and respectfully within the province. We believe that if we're careful about how we approach communities that we've not been to in a while, and we visit respecting the views and values of the people in those communities, phase 3 achievements will be as positive as those at phase 2. And as we get to the point where we can all share the beauty of British Columbia traveling around, we need to remember that although we're going to have a summer that's better than we would have thought perhaps a few months ago, this is not a return to normal. We need to make sure that we maintain the practices in our own community as we travel to other communities. That means we have to continue with the foundational elements that Dr. Henry's put forward and that we have all followed so carefully. Physical distancing, and when not possible, be sure to wear a mask. Always have your hands as clean as they can be, and of course, stay home if you're sick. This is especially true as we travel around the province, and we ask that you have a plan before you leave. That means making sure that the community that you're going to is prepared to receive you. There are communities around British Columbia that are still quite concerned about travelers coming to visit. I think of the Haida in Haida Gwaii. I think of the Helsuk in Bella Bella and the Nuhawk in Bella Coola, as well as here on Vancouver Island and the Chalmette Tribal Council, who have asked government to give them more information about how we plan to proceed. That information will be delivered by the Minister of Indigenous Relations, as well as the Minister of Public Safety and the Minister of Health, as we are as transparent as we possibly can be with those communities that are still reluctant to see people from away. So as you interact with other people, you need to keep track of that. One of the elements that Dr. Henry may talk about and has been talking about is the importance of contact tracing. So as you're interacting with more people and your bubble is expanding and you're going to communities that you haven't been to in a while, be mindful of who you're around, be mindful of what you do. Our government has reached out to Indigenous and municipal communities to let them know that the restart of phase 3 is upon us, and I think this can be an exciting summer for all of us, but be mindful that this is not regular programming. This is an extraordinary summer that will require a continued effort by all British Columbians to respect your neighbours, respect the communities you're going to, and always be kind, be calm, and be safe. Cabinet met again today, and as we did 2 weeks ago, we reaffirmed the extension of the state of emergency until July 7th. As we enter into phase 3, we need to do so cautiously, and the state of emergency allows us to continue providing supports for people and businesses. On Monday, we tabled in the legislature the COVID-19 Related Measures Act. This act will allow us to ensure that the activities that we've undertaken under the emergency order are codified in legislation, and that bill is being debated this week. And so to all British Columbians, as we start phase 3, congratulations. I'm so proud of what we've been able to do as a community to lead Canada, quite frankly. And as we look to the United States over the past number of weeks, we've seen spikes in cases just to the south of us in Washington State, as well as Idaho, Oregon, Nevada, Arizona, and California. These are traditionally the people who would come to British Columbia in the summer to enjoy our tourism attractions, and that's why it's so critically important that we continue to work with the federal government to keep our international border closed so that we can protect British Columbians and not give up the ground that we've been able to accomplish over the past number of months. And with that, I'll invite Dr. Henry to say a few words, and then we'll open up for some questions.
Thank you, and good afternoon. As the Premier has said, we have all worked very hard to find our balance during this pandemic, our pandemic here in British Columbia. We have flattened our curve and safely increased our social interactions, whether that's seeing friends, going back to work, or back to in-class learning that we have seen in the past couple of weeks. We've done this by continuing to follow our core foundational rules that I have spoken about many times. These rules are our guideposts. They're the foundations of how we can continue to safely move forward. Until we have an effective treatment or a vaccine, COVID-19 will be with us in our communities, thankfully right now at a very low level, and we want to keep it that way. We have seen all around us what can happen if we're not careful. What this means is that we have to keep doing what we have been doing and not do any more. Even as we see more people and start to travel in British Columbia, we must still keep our circles small and take the precautions to keep ourselves and those around us safe. If we go too far, we risk a rebound and we risk losing ground that we have worked so hard to get. None of us want that. So respectful travel, our travel manners as we go into this unique summer, means maintaining those safe social interactions, planning ahead, and being prepared. This will be a unique year and a unique summer for all of us. In this COVID time, we have shown each other in the phase 2 that we have been through that we can be safe and we can enjoy so many things. As we gradually transition into phase 3, I ask everyone to please stay vigilant and do your part to keep our communities, our elders, and our loved ones safe. And no matter where you may be this summer in British Columbia, be kind, be calm, and be safe. Thank you.
I have to say, both of us had intended to say that this is not the summer for the big family reunion at the cottage. Again, keep your gatherings as small as you can keep them and respect the health and well-being of your friends and neighbors. And with that, Jen will take some questions.
Reminder to reporters on the line, please press *1 to get in the queue. Today we're going to be having a question and a follow-up if you have one per reporter. We're going to start with a question from Richard Zussman.
Premier, the numbers we saw yesterday in the modeling from Dr. Henry reflected that we're at a bit of a tipping point here. Is there any concern or nervousness from you, as we heard Dr. Henry saying yesterday she was nervous, about moving into this next phase?
Well, I have to say that I have great confidence in British Columbians based on the track record over the past 100 days. But having said that, Dr. Henry and I have discussed this with Minister Dix at length, as well as within Cabinet. Everything is about risk and risk management. It's not about going too far. It's about going safely to a place that British Columbians are comfortable with. I've said from the beginning that it's not about flicking a switch. It's about a gradual process. And although we did see more interactions faster than we had anticipated, I think it's fair to say, the results have been by and large positive. And I'm confident that we can say to British Columbians, if they're mindful of how we got here, if they continue to practice the safe behavior that they've modeled over the past number of months, that we can be in a place where we can get through the next number of months, where people can enjoy the summer, get out to see some of the spectacular parts of British Columbia, and not put themselves and other people at risk.
Do you have a
I'm
follow-up?
hearing from hearing from a lot of people concerned about already having a hard time finding a place in British Columbia, that a lot of hotels are booked up, other destinations are booked up. Have you heard these same concerns, and what should British Columbians do that are struggling to find places to visit this summer?
Well, I certainly know that I had difficulty trying to get a place at Saratoga Beach, so we're without a place to go at this point, but we're going to keep trying. And I think those operators, hospitality operators who are out there hearing Dr. Henry's modeling yesterday and hearing our announcement that we're slowly moving safely into phase 3 will allow people to perhaps open up areas that they had not planned on because of the crisis that, of course, is a global pandemic. But I believe that I talked to Minister Heyman today. Over 100,000 campsites have been booked, and there are still campsites available, I believe. People should continue to try and get a space in the time that they can travel. But it's going to be a challenge, but I think it's going to be a positive challenge for tourism operators. The biggest concern I have for our economic restart is the absence of literally hundreds of thousands of international travelers who have historically looked at British Columbia as a place to come and visit. That's going to have a profound impact on the tourism economy. We know that, and that's why it's more important than ever that British Columbians, if they can have the means to travel and to do maybe that special holiday that you've been waiting for a long time, instead of going somewhere else, do that right here in BC.
Our next question is from Rob Shaw.
Well, hi, Premier. You just touched on it there, but there's a lot of pressure on you from the hospitality, tourism, business sectors, tourism-dependent communities to allow this travel to save thousands of jobs and businesses. And I just wondered if you could reassure the public, you are making the best public health decision you can on proceeding to stage 3, or are there political and economic pressures that are leading you to announce what you're doing today based on the expectation from the public that they want to get out there and travel?
I know that British Columbians have behaved exemplary over the past 100 days, to the point where we've seen the best results in Canada for a province of our size. When I look to the south, I see chaos. I see exponential increases in caseloads in states that are here on the west coast, as well as those inland. And so I'm confident British Columbians are prepared and ready to act responsibly. I feel no pressure other than the traditional pressure that I would feel in this job, which I can't measure against last year because this is a year unlike any other. And I know that I've been taking advice from Dr. Henry and her officials. Dr. Henry would not say that it's safe to move on if she didn't think it was, and I'll allow her to answer that on her behalf. But I don't feel any pressure at all, Rob, in that sense. I'm just trying to do the best I can for everybody, and I commend British Columbians because it's their hard work that's got us here, based on the guidance that we've received from public health. And the hard work of British Columbians, I think, deserves a bit of time at the lake or on the beach.
I would absolutely agree. These are things that we consider very carefully, but we are at the point where we need social interaction. We need to be able to have our economic engines going, and part of that is traveling, seeing people, going to places that we need to visit, whether it's family, whether it's needing a break. We would not be making these recommendations if we weren't confident that we had put in place the measures that we need to do. Having said that, it does not mean that this goes back to a pre-COVID normal. We are in a very unique and unusual time, and this is going to be a different summer. It means that we're just going to have to be careful. We're going to have to continue doing the things that we are doing. And if we're talking about people coming in from other provinces, then we need to help them understand how we have done this here in BC. And that means we need to have signs up, we need to model the behavior, which is keeping our distance, staying away if we're ill, maintaining our hand hygiene, and that's the things that are going to get us through this. But we always know there was a balance, and we are at the point where we need to address some of the unintended negative consequences of the measures that we've put in place. And we are watching very carefully and will continue to. And the other part of it is making sure that we have the resources that we need, to make sure we can find cases very quickly. So that's the testing capacity which we have, plus the public health capacity to follow up on every case and make sure we can find all of the contacts very quickly and suppress any clusters that arise before so that we don't have rapidly increasing cases, which is a long way to say. I think we're at that point now, but we need to do it as we have been, carefully and safely.
Follow up? The question maybe to both of you, the film industry you mentioned, they are asking for some of the same considerations the NHL received recently on cohort quarantine concepts to help them reopen, I guess, as part of stage 3. Is there any consideration from either of you on allowing the film sector to have that group quarantine permission the same way that the NHL bid has had?
I'm not aware of any specific requests from the film industry to compare themselves to any other sector. I know they're unique and diverse. We have extraordinary talent, behind camera talent, post-production talent here in British Columbia. I think the big issue for many of the productions here is U.S. front of camera personnel coming to British Columbia and how they would fit into the quarantine. And we have no intention at this time. The federal government are our partners on this. They control the border of dismissing in any way the 14-day quarantine period. We do have on our Economic Recovery Task Force the Executive Director of Creative BC. She has been focused and working with us step by step. Minister Baer talks to the industry regularly. We're very anxious to get film up and running, and in fact, we're very close to that. By announcing today the move to phase 3, the producers and the other productions that are underway in BC will make their choices about how they're going to proceed. But I would say that compared to Hollywood North's looking pretty good on the health front, and we do have extraordinary talent here, unprecedented vistas and scenery, as well as studio capacity to meet the needs of many, many productions. But I don't think there's a comparison between the NHL proposal, which was going to be a group of people in one place, as opposed to the film industry, which is dispersed right around British Columbia and has people, domestic staff that would still be part of any production that takes place here. I don't know if you want to answer that.
Yes, my overriding concern has been and will be making sure that all of the safety protocols that we need to protect our communities here in BC remain in place. And so the NHL proposal was very specific and very, it exceeded the requirements that we needed to ensure there was no contact with the public. And it's a very different situation, as the Premier has said, around the film industry. So there is no waiving of the 14-day quarantine. And as a matter of fact, the NHL proposal was quarantine essentially for the entire time that they're here. So yeah, we will look at everything as it comes across, but the overriding importance is the safety factor.
Our next question is from Binder Sajan.
Hi, Premier. Just on the film and television, how quickly do you think that industry could be back up and running, and how important is it for BC's economic recovery?
Well, I think the pace with which they'll return is entirely up to them. We are certainly greenlit the industry. The guidelines have been developed through Public Health and WorkSafe. The production teams will be looking at how quickly they can move, what's the availability of the front of camera personnel that are required to get these productions up and running. I would suspect is certainly after the 14-day quarantine period, they can be shooting at their leisure. Again, being mindful of the conditions that are in place, the guidance that has been provided by Public Health and WorkSafe, and I would encourage them to come and get started. I know that I'm running out of things to watch on Netflix. Some new content would be good. And I also know that the jobs that are connected to the industry are critically important in British Columbia, not just in the Lower Mainland and the South Island, but indeed across the province. So we certainly want to get those jobs back as quickly as possible, but we're only going to do it if it's safe to do so.
And just to follow up on the travel, I know you've often said that, a month or two away is a lifetime away, but if people are encountering perhaps operators that are booked up in these early days of summer, how far in advance do you think it's reasonable for them to book their vacations?
Well, I know I can speak from my personal experience. We were hoping that the middle of August would be a time that we would have an opportunity to get away. So we've been talking about that. We've been, surfing the net, looking for opportunities, places we'd like to go. I would be remiss if I didn't mention Barkerville. Certainly is a place that I love in the central part of British Columbia, just outside of Quesnel, where you could also go for a swim in the Cottonwood or walk through the Pinnacles. There's lots of places to go, and there's lots of capacity within the system. People should, if they have the time and have the ability, they should be planning their holidays right now.
Question is from Rob Buffum.
Well, hi, Premier. Thanks for the time. I have a question related to tourism as well, and I'm just wondering about, given that we're at this delicate balance of 65 to 70% interactions, and if we get up to 80%, that'll be a problem. What are your thoughts on messaging in terms of enforcement of these guidelines, as well as the possibility of reverting back to no travel around the province if people don't stick with these rules?
Well, thanks for the question, Rob, and I'd prefer to approach this from a more hopeful perspective, and that is that British Columbians are anxious to expand their bubble to see more than their neighborhood. And we have collectively have behaved in a way that allows us to do that. And I would assume, I'm hopeful, that British Columbians, as they leave their home communities and start to travel farther afield, will be mindful that they're going into someone else's neighborhood, and they should be respectful of that and practice the same procedures that they put in place in their own hometown, in their own community, wherever they're traveling to. And we'll take it as it comes. Dr. Henry may want to talk about the 65 number. I think that, again, we have tried, and the advice that we've been given from public health officials, to weigh these questions as thoughtfully as we can, and then make decisions based on that advice. And that's what we're doing today. And I'll ask Dr. Henry perhaps to fill in on the 96 or the 65.
Sure, and I think we need to realize that that is a model, and it does not, it cannot take into account the types of contacts that we have. So for the most part, we have been having safe contact. We've been doing the things that we need to do, like keeping our distance. We've learned how to go to the grocery store and the pharmacy and now other shops, and we know how to do that safely, and that's reflected in the fact that we have very low case numbers, and importantly, low numbers of people in hospital and ICU, and those are more reflective of how much transmission we're having in our community. So we take those two things together, and when you have small numbers of cases, the models can be quite unstable, we call it, which means there's a wide confidence interval. So we're somewhere around 65% maybe, but there's a wide range in there, and that's because our numbers are low. So taking those two together means that we have found a nice balance. We found a balance of increasing our contacts and doing it in a way that's safe. So that's why we need to continue to focus on that. We need to keep this balance for the coming months until we have an effective vaccine or a treatment. And those are the things that we need to work on. We've been doing it over the last few months, and we've been doing it well here in British Columbia. We need to keep that up, and we need to ensure that if we're going to other communities, we take the same measures that we have been taking at home. So as we mentioned, this is not the summer for large family gatherings and big parties, particularly where we have people who are more likely to have severe illness or end up in hospital or die from this disease. So that is the things that we need to do to protect our elders, to protect people with health issues that are more likely to have severe illness. So keeping things small, fewer faces, bigger spaces, the things that we have been doing will get us through this very unique summer, and will get us through the coming fall as well.
Thanks. I just had one follow-up related to the film industry, and that is, given our low case numbers here and the fact that working outside is valued in this current pandemic. I'm just curious, Premier, now that we're here in phase 3, you've spoken about it previously, but what's your optimism levels given the attractive qualities of BC that the film industry is going to do better now than ever?
Well, again, it's going to be difficult to compare economic statistics this year over last year or over next year. This is an extraordinary time. There's no question about that. But I do believe that all of the fundamentals to success in the film industry are here in British Columbia and have been built up over the past quarter century. We have skilled workers, they understand the sector, they know what's required when a production begins. Producers come to British Columbia, the third largest film production location in North America after LA and New York. That's a prideful place for us to be, and I know the workers in the sector take their work very seriously, and the opportunities to get ahead of the other production areas. I know New York and LA are not, they're still experiencing, less so in New York, but certainly in California, they've seen a significant spike in cases, and I think that again makes British Columbia look very appealing to producers who want to get their productions underway. British Columbia is a good place for that to happen. So I'm hopeful that, again, with the guidelines in place and everybody working with the view of safety and well-being for everyone, we'll have a positive summer for the film sector, yes.
The next question is from Shannon Waters.
Hello, Premier. Chief Coroner Lisa Lapointe issued a statement yesterday expressing concern over the bill that the Mental Health and Addictions Minister introduced. Lapointe says the bill could have serious unintended consequences, including more fatalities, if it isn't paired with evidence-based accessible treatment options for people struggling with substance use. So far, that's a system that many people would say your government hasn't yet realized. Will you be announcing additional investments in treatment to offset the possible negative effects this bill might have?
Well, we're very concerned about the other public health emergency, the opioid crisis. Dr. Henry, when she first came on to be the public health officer, I guess it's 2 years ago now? 2 years, wow. I guess I've been Premier for 3, so between us, we came in expecting to have a positive impact on the opioid crisis by bringing in measures like a standalone ministry focused on reducing dependence on opioids. We have had been making good strides until recently, where we've seen an absolutely unacceptable spike in opioid deaths. That's a significant concern to the public health officer. It's a significant concern to us. And that's why we brought forward the legislation. Many families of young people who have left us because of a death from an overdose have asked and appealed to government, both parties, the opposition and the government, to come up with some suggestions about how we can do more and better for young people. And that's the intent of the legislation. I know the minister will engage with the coroner to ensure that any of her concerns are addressed going forward. But today is not the day to announce new funding. Today's the day to announce we're moving into phase 3, and the debate in the legislature on Minister Darcy's bill, I'm sure, will be informative. And as we do with every piece of legislation, Shannon, we'll listen to the overtures from the other parties, and we'll try our best to improve the legislation. And if there are more resources required, that's a process of government that starts with Treasury Board and ends with a decision. But we're seized that with the challenge on the opioid crisis, particularly with young people, and that's the focus of Minister Darcy's bill.
Just as a follow-up, I was looking at the numbers for illicit drug overdoses since your party formed government. There's been more than 3,600 so far. So we've seen a recent spike, but aside from sort of a slight decline around the end of last year, beginning of this year, the needle doesn't seem to have moved on the issue yet. Just for reference, that number is more than 21 times the number of people who have died of COVID-19 in BC so far. Your government has been lauded for heeding the advice of Dr. Henry on COVID-19, and I'm wondering if it plans to do the same when it comes to her recommendations around decriminalizing people who use drugs. There's a special committee that's about to be struck in the legislature to review the Police Act, and I'm wondering if Dr. Henry's recommended changes to the Act and its regulations might be part of that review.
The House leaders are discussing the configuration, the makeup, and the terms of reference for the review of the Police Act, and it will contain a whole range of issues. Some of them are currently topical, some of them are long-standing. With respect to the challenge of the opioid crisis, we were under no illusion that this was a significant challenge, and we've been working as hard as we can to bend that curve as well. And we had been making progress relative to previous years, but it's been an unacceptable increase over the past number of months. Dr. Henry's, my first interaction with her when she became public health officer was on this very question. The minister is seized of the recommendations that she's brought forward. We have substitute therapies in place in many parts of British Columbia, and we're going to continue to act on those recommendations as we're able to.
Our next question is from Justin McElroy.
Premier Horgan, what is your message to people in other parts of Canada who may want to travel to BC now that our province is entering phase 3? Are people from other provinces being welcomed in BC now?
Well, Dr. Henry and I have never said that we were going to restrict the mobility rights of Canadians. We've always said, particularly with respect to people from Yukon and Alberta, our immediate neighbours, that if you didn't need to be coming to British Columbia, perhaps you should stay at home. Now that we're moving into phase 3, our message to them would be slightly amended to say, certainly if you're coming to British Columbia, be mindful of what British Columbians have done together to get us to a position where we can welcome people from other parts of the country. Our focus right now, of course, is on making sure that British Columbians can travel freely and enjoy British Columbia, but there are many border towns with Alberta, and indeed, Dr. Henry and I were talking about the Yukon is opening up to British Columbians, although there was a special amendment between the two jurisdictions because places like Atland, for example, depend on services in Whitehorse. Although British Columbia residents, they spend much of their time in Yukon territory, and so the Premier of Yukon and I have been working closely to make sure that those connections can be intact during this period. And to all those Albertans who have properties in British Columbia and spend much of their time in British Columbia, I'm certain that they'll be coming for the summer, and we welcome them. Also being mindful that we hope that they'll abide by the guidance of their neighbours on how to act and comport themselves while they're here for their safety and the safety of British Columbians.
And I guess as a follow-up to that maybe to Dr. Henry, if there is an unwelcome flood of tourists from other provinces, or if there is a sign that there becomes COVID cases that can be traced to other provinces, is there any scenario in which BC would bring in measures that could restrict other Canadian visitors?
We, from the very beginning, have not done that for very important reasons. We have lots of reasons why people go back and forth, particularly to Alberta and in the Yukon, for example. So we have across the country as well worked together to manage this pandemic, although each of us has experienced something slightly different. So I don't see us ever putting in restrictions. We haven't so far, but we want people to have their travel manners on when they come here. So make sure that they're doing what we've been doing so that we can all stay safe in our communities here in BC and when people are going back and forth to their communities in other provinces in Canada.
We only have time for one more question today, and it's from Justine Hunter.
Oh, thank you, Jen. I owe you. Premier, the economic cost of the pandemic this year clearly means your streak of balanced budgets is going to end. Can you give us any sense of scale of the hole we're in right now?
I can't. I can tell you that it is a hole, and it's a big one, and it is shared by every province in the country, every state in the union below us, and nations around the world. This has been catastrophic for globalism. It's been catastrophic for the economy. Minister James will be releasing details, I believe, second week in July, when we're getting closer to the end of the first quarter, so that British Columbians can have an accurate understanding. But it would be my speculation at this point. I do know that we're doing everything we can to meet the needs of businesses and to meet the needs of people during this period. The economy is people. If whether you write the check or cash the check, you need each other. And we're focused on making sure that businesses can get through this and that the employees that they depend on can also get through this.
And I know we're going to get that detailed update in July, but what can you say about what steps you're taking to stabilize the economy, to kind of flatten that other curve?
Well, one of the things we did from the beginning, and again, it was with guidance from Dr. Henry and her officials, as well as WorkSafe, was to, instead of just appealing to the shut it all down, I remember very vividly in March and into April being at this podium and having appeals from media representatives saying this province or that province is doing this or that, why won't you? And we have charted our own course from the beginning, because our approach, and certainly Dr. Henry's approach, was how do we solve the problem rather than just identify the problem. And so the construction sector, for example, we worked very hard to keep construction going, admittedly in a different form than it had been in January and February, but it kept going. And it's very easy to shut something down, very difficult to start it up. And I can point to examples across the country, but I know your paper, Justine, has inventoried those in other provinces, so I don't need to do it here. But one example would be K-12 education. There was other provinces picked dates arbitrarily and said we're going to be back on this date. We didn't do that until we were comfortable from public health, based on the science and based on working with stakeholders, whether they be teachers, administrators, support staff, trustees. We worked together to find a way to have the month of June as a test case so we could understand how we can best proceed with the new school year in September. And that this past 3 weeks has been critically important to helping us shape how we go forward in September. This is a good day for British Columbia as we together go into phase 3. But we need to remember we are not leaving COVID-19 behind. It is here in every corner of British Columbia, and we need to behave accordingly. And we need to prepare ourselves, not just as individuals, but our economy to manage that. And that includes K-12, it includes post-secondary education, it includes a whole host of activities that all involve people. And that's been our focus, and will continue to be our focus until we find the relief that Dr. Henry talked about, a vaccine or some other therapies to help us through this.
Thank you, everyone. That's all the time we have today.
Thanks.